Good morning.
Good morning, Gina. How
Good
are
morning.
you?
Good.
Happy
Good.
Friday, everyone. So you're joining Reflect and Reset with Maria and Gina. And where today is going to be a very fun show because we are going to be talking about the latest beauty trends.
Yes.
And many of you might not know, but Gina and I have an aesthetic center. And this is a fun part of our work. It's called Transforme MD, and it is located right where Forme Medical Center is, 711 South Broadway in White Plains. And we are going to talk about all of the different procedures and wonderful stuff that we're doing.
That we actually do on ourselves.
Yes.
Because somebody has to be the guinea pig.
Not just that, to look this beautiful,
well,
right?
As we get older, we got to do everything we can to try to maintain those looks. So,
absolutely. And all joking aside, I mean, beauty is something that when you look at yourself in the mirror, you feel good about the way you look. It's part of having this mindset where you are in a holistic way taking care of your body, not just the inside but the outside. And I know for women, Gina, this is something that it's important.
And you know what I also love about our center is that from the moment you walk in, the experience starts. From the calming music, from the smells and the lavenders, the essential oils, and then of course our staff, Sandra and Edna and Jenna and the doctors are just amazing.
They're amazing people. Yeah. And when I go out there, I'm like the billboard of Transforme.
So everybody who meets her gets an appointment at Transforme.
I happen to love it. I happen to see.
Well, you believe in it.
Yeah, absolutely. Yeah. One of the things that we wanted to do was to be able to get a lot of the procedures, because then we could really promote it and believe in it.
Yeah, exactly. And and I was talking to Bob on the way out, and it's great for hair loss. I mean, there's so many different things that you can do, not just on the outside, right? But then also holistically on the inside. But then you're taking care of you can take care of your hair, your face, your body. I mean, everything.
Yeah.
Everything.
So we have our guests, and tell us about our guests.
So Edna works with us. She's a nurse esthetician, and she performs a lot of the procedures.
Yeah.
From PRP, which is the vampire facial, as people mostly recognize it.
And we're going to talk about that in detail.
Yeah, we do. She does the lasers for us, as well as the True Sculpt that Maria touched on this morning. And we have multiple services that Edna's going to speak to us about.
Hello, Edna.
Good morning, everybody.
Good morning, Edna.
Edna, we are happy that you're joining us because you are a fountain of knowledge when it comes to the beauty, the aesthetic world and rejuvenation. So,
and actually, Edna is our face, pretty much, of Transforme. She does all our videos.
Yes.
Mm-hmm. Well, you guys are my marketing team. Wherever you guys look around, you see our work. So
that's it.
I guess it works both ways.
It does. And for those of you that want to see Edna, just go into our Transforme Instagram and social media, Facebook. She's gorgeous, and obviously we mean that. And Edna, we want to really be able to give a lot of information about the new trends of beauty procedures. And I know one that we are promoting actually this month is the vampire facial, which is also called the PRP facial. And I want to talk about that specific one because it always interests people when Gina and I say, "Oh, we get the vampire facial."
Actually, I'm set for my appointment at 4:00 today. So
yes.
Yes, get ready.
We can't wait.
So yeah, that is the newest thing right now. Again, it's working with your own body. So what we do again is that we draw the blood and then we centrifuge it and use the actual plasma. It has all the growth factors. It's actually now named liquid gold. It actually started working with orthopedics. They started actually injecting knees, and they saw how the actual knees or joints were being regenerated. So they're like, oh, what can we do with this? So they actually started doing on the face as a facial. It could be done with different modalities. Again, they do it with injections, or we could do it with microneedling. That also helps stimulate collagen and elastin.
Mm-hmm.
So the best thing about this that it's using your own body. I always tend to tell my clients right before that I do it to just make sure that they eat well for the next 2 weeks, because we are using the blood, and you could actually tell the difference between, like, I can say, hey, this person wasn't eating so well this morning, because you can tell how good of the plasma is.
Interesting.
What else?
Edna, like Gina and I said, we both are a very big believer of the vampire facial, because we've been getting it. I would say I've been getting it for over a year now, I think. And I see my skin. Everybody talks about our
notices,
skin,
yeah.
that our skin
glowing.
glows. And yeah, it's and what I love is the whole experience, because when we do the PRP, I mean it takes about an hour to an hour and a half
Because they get the
sometimes.
facial as well.
They get the facial, and tell us what you do to prepare the skin for the before you inject the plasma.
Okay, so when it comes to us, we have to make sure we cleanse the skin, we do an exfoliation, and then depending on the skin, if it needs a peel, we do a peel. Afterwards, we have different things that we can do. If the person wants radio frequency, if you feel that we need it, we actually add that to the actual facial. If they want, we could also do a vitamin C infusion with our Fusion X machine, that it also, again, stimulates collagen and elastin, and it also has added chromotherapy. Chromotherapy is basically a light therapy. For example, we use the blue to kill bacteria, and then we use the red to actually stimulate collagen and elastin as well. So it's like everything that we do here is, again, to stimulate collagen and elastin. And again, we take all ages. It's not, 30s, 40s. You can start at their 20s, because it's also maintaining. What I always tell people is not like, I'm not trying to fix you. I'm just trying to better your skin. So even when people are, a little bit younger, like in their 20s, what we're doing is maintaining what they have. So and then after we do all of that, we actually prepare the actual plasma, and then we inject it back into the skin. Or if we do the hairline, we could do that as well. Again, the actual needles are very, very small, so I'm not saying that it's not painful, but
right.
it's basically very doable.
Yeah.
Because we're adding nutrition into, let's say, if we do a facial, it's into the skin, and if we're doing in the scalp, and again, it's just to grow, because it promotes hair growth.
So it also sounds like you're saying that with every patient or everyone that comes in, it's you consult with what they would need before the plasma. So in other words, my skin's a little ruddy, you might do the microdermabrasion on me first, and then, so you actually are treating the skin depending on your skin type first.
Exactly.
Which is,
so if you need a little bit more hydration, we do that.
Mm-hmm.
If you need, like you said, more extraction.
Yeah.
But everybody's skin is a little different, and each time we're going to be able to do a different thing. And remember, PRP doesn't just go like on the face or the scalp. It could actually go on the legs as well, like to help the skin that starts being a little creepy, like right around the knee area.
Oh, that's
we
me.
can actually do PRP as well.
We're gonna do that on me today too, though. We're gonna do the face, we're gonna do the hair, and we're gonna do the knees today.
Yeah, Gina is getting the complete treatment.
Yeah.
One of the things that you also do, because since we get it done, is you concentrate on the neck area when you do the PRP. I know that this happens when we get the treatment. We get the PRP or the platelet-rich
And
plasma
in the chest.
injected
And in the chest.
in the neck, the chest,
Yeah.
and the hands. Believe it or not.
And we cannot forget the hands as
Mm-hmm.
well.
Yes. I actually did a video, which we're going to be posting. I'm not sure if we're going to do it next week, but I did a video of me getting the treatment. And we show how one hand, as she's injecting, looks compared to the hand that has not been injected. And you see the difference.
Oh, yeah.
It's incredible.
Ridiculous. It really is ridiculous.
So, how often should people, once you start doing the PRP, how often should you do it?
When it comes, everybody's different. but it's not a problem if somebody does it every month. What it is that we have something called a cell turnover. So we have to make sure that we remove all those dull, dead skins. So then the new, beautiful, fresh ones are the ones that we're going to bring about. So that's why it's good to, it's okay if somebody does it once every 6 months. It's not going to be an issue, again, because it's your own body. But if somebody wants to do it every month, it's always at best.
Mm-hmm.
You know, we know.
This is for all kinds of facials, by the way.
Right.
Just even if it's a signature facial.
Right. I know, Gina, I don't know if you had the same experience, but when I started doing the PRP, I was doing it more frequent, and then I realized that I didn't need it as frequent.
Yeah.
And I remember Sandra saying that, you know, your skin is it's fresh.
You're changing the whole texture
Yeah.
of it.
It's I definitely see the difference in my face.
Yeah, I see it.
So we are, and I'm gonna, for anybody that wants to call, we are Reflect and Reset with Gina and Maria, and people can actually call and ask questions at 636-0110. And we are live on Facebook. If anybody on Facebook wants to ask us any questions, we will be happy to answer them. So we're going to move from the PRP, and what other procedures should we talk about that are
We can,
fun?
since we touched it this morning with Bob, we can talk about the True Sculpt.
Yes.
The True Sculpt is one of my favorite machines.
So mine too, and I believe in this machine so much that I actually did a video. In that video you can find on Facebook or LinkedIn or Instagram of me getting the True Sculpt done. And I can tell you the before and after, even though I've always been in shape. I mean, I work out, but there's certain areas that no matter how much I work out.
Problem areas.
Yeah.
Everyone has them.
And, you know, my lower belly and the little love handles, which people will look at me and say, oh my God, Maria, you're in great shape. You don't really need that. But it's something that you notice when you have your clothes. And when you're wearing clothes and it's a little tight. And what I notice is, I mean, it's been 6 months, I think, since I did it. And I see when I wear a bikini, I see my body totally different.
Yeah.
I actually can see the six packs.
I actually did all the areas. You know, so I think, and if I'm not mistaken, let's say I did my bra area, I did my back, I did my belly, I did my legs, and you know, I totally see it different. And then that with the mesotherapy, which I think Edna should talk about as well, which is really an amazing thing. But you know, just to go back to the True Sculpt for a second, if you know, last week we had Victoria's Secrets.
Yes.
We had 2 Victoria's Secret models in our facility having treatments done.
Yeah.
And because this is how popular that this machine is becoming, and how it's a maintenance. You know, it really turns out to be a maintenance. It's wonderful.
It's a great machine. So Edna, tell us how it works.
So when it comes to this machine, what it does is that it uses radio frequency to target the fat cell. What it does is that at a certain temperature, the fat cell basically bursts, and your body takes care of it. Either you know, once you go to the bathroom, and people have told me that when they go to the bathroom, they see, you know, I don't want to get too much into it, but it's just they see a little bit of cloudiness. It means that, you know, all the fat cells are basically going away. I always tell people to make sure that they drink lots of water, because again, it's very important to hydrate. The thing is that this actual treatment works in your body for 12 weeks. People start noticing differences, you know, between even the first, second day, or like, but then there's others that take a little bit more, roughly 6 weeks. The greatest thing again about this machine, I'm not trying to bash any other treatments out there, because I'm not that kind of person, but the best thing is that we only need one. Not only does, again, kill the fat cells, but it again stimulates the collagen and elastin in the skin, so you don't have that saggy skin. I've seen other treatments out there that not only do you need to do whatever sculpting with that machine, but they have to use another one to help with the skin, and this one has it all in one.
And it also is not as pain. It's not. I mean, there's no pain at all. It's for me. I guess I should say that, because
No, and you know what, the actually the heat, and I can remember, you know, I've experienced it a couple of times. The heat is so great in the beginning, but if you can get through the first 10 seconds, it goes. Your body adjusts to it. It's just have to get through the first 10 seconds.
Yeah.
Everybody's a little different, because everybody is wired differently, no matter what. And but what people have told me before is that it feels like a very hot stone massage.
Yeah. Oh, I've heard it
After
feels a
while,
little like an iron sometimes.
You know, people may need a little break here and there, but like you said, after the first 10 minutes are like definitely the hardest.
And you know what's funny is that my younger brother Michael came in to have it done. And remember, Edna, he checked it out. He was like, "Oh no, I can't do it. It's too hot." I was like, "Just give it a." I'm going to talk about. It's my brother. I can talk about it. And he only lasted. I said, "Just let it work for 10 seconds. Just get through the first 15 seconds." He's like, "No, I can't do it. I can't do it." I was like, "Oh my God, these men hold chickens.
Yeah.
They're all chickens."
So this procedure is something that it takes how long Edna to do the procedure?
Again, when it comes to us, we do it by hour.
Okay.
So you could do depending on what areas you want to get, but you could do your thighs, your love handles on your stomach. You could do your arms, but it's basically 15 minutes on each zone that we work on.
And also, I'm sorry, but we really need to let everybody know that this really is a contouring machine. So if you're overweight,
This is
not for you.
this is not for
you
you.
need to get to the point where you feel good about yourself, your body is more into shape, and then this is a perfect.
Right.
That's definitely, I have various people that come different sizes, and I just advise that it's best that, they continue with their weight loss regimen and then come to us because they're going to see better results.
And some people, I know that they love their body shape, even if they're a little fuller than what we call the norm.
Yes.
And the machine is also good for those people that they just want to shape different areas of their body.
Yep.
So Edna, let's move to another procedure that I think it's a great one that a lot of people could use, especially in the neck area, which is the threading. Could you talk to us about the threading?
Oh, that's a great thing. Again, it's another treatment that started off because we're basically using bariatric and cardiac sutures that they're basically they're pliable, they're malleable. You could actually, they move. So that's why when we do the procedure afterwards, we often say, hey, make sure not to talk, not to move your face, because we want that to stay. So what it is that we basically enter the skin and we injure the skin a little bit. So basically there's like a little form like of a scab inside of your skin. So the actual thread gets absorbed into your skin, but what remains is that scab inside. So what we could do is basically create a lift on areas like you said, around the neck, around the
jowls,
face,
the jowls
area right now, and we can do thread on the legs as well.
Yeah, which we haven't done on me yet. So I did my jowls, and I see a total difference. But I haven't done my legs yet, so I'm coming.
And Edna, how long does it take for this procedure? And then what is the recovery? Because I'm sure there's recovery there.
Again, the procedure could, it's 15 to 30 minutes. Again, depending on the person and how much they're going to do. It's roughly 2 or 3 days, again, depending on how fast the person heals. But we would like them to, like we told people before, to try not to talk, try not to make any kind of gestures, so they can see better results.
And this is really in lieu of people that think that they want a facelift, but they don't need it yet.
Right.
Exactly.
And this is so cost effective, especially at our place, because we make everything cost effective for people. But it's, for me, if I was going to go for a facelift, it would have cost me $15,000, $20,000. And this is just so reasonable, and you totally see the difference.
And even, I know I'm talking to Sandra that even after it's done, for 6 months, you still continuing to see the difference, even after 6 months later.
Actually, and Edna, maybe you can touch on this because with Sandra always adds the mesotherapy with it. So after you have it done, like on a monthly basis or sometimes weekly, like she does meso on my face and my legs, and it enhances the lift, correct?
Yep.
So
Yeah. So Sandra, it's sort of she's the director of the Aesthetic Center. We keep mentioning her name. So she basically guides everyone. And what we do is we have Edna, who's the nurse esthetician, and Dr. Middleton. Actually, they do a lot of these procedures in the guidance of. With Sandra. So when you come in and you get the PRP, you actually get a combination of many times of Sandra and Edna, or Sandra and Dr. Middleton. And when we're doing the threading, it's the same thing, it's the same combination. So you guys work extremely well together as a team, which is something, wonderful to see. We really enjoy like all of the seeing you work and the results that we get from these patients.
everyone's so happy.
Yeah, it's beautiful. And in addition to that, Edna, tell us other things that you would recommend. And depending on age, let's talk. Let's say about Botox, which is the most popular, thing that people get now, because I don't think it matters the age. So tell us a little bit about Botox.
Not at all. The thing is that we already know that Botox not only helps with the fine lines and wrinkles on the face, but it also does. Was I able to get rid of my little wrinkles on my forehead? But I have a condition called hyperhidrosis, which is an excessive amount of sweat. My hands used to sweat horrible. Like, I was always embarrassed to hold somebody's hand because I was constant embarrassment of my sweat, especially my underarms. And with the help with the Botox, I don't sweat anymore. And for me, it's definitely something that has been life changing. Anybody that has hyperhidrosis has to get this done. It is, again, or somebody that just sweats a little more and wishes not to, should get Botox under the underarms as well.
Okay.
My daughter did it in the hands, and she said it was just amazing. She had the clammy. Your hands are always clammy,
Yes.
They're beautiful now.
That is great. I mean, many people don't understand that they actually don't need to suffer, with this disease. I guess that, it's so uncomfortable. I mean, it is. Edna, for men, I know that one of the most popular thing, unfortunately, men, for whatever reason, they don't believe in getting these treatments, right? And they're missing out a lot.
Except for my cousin.
Oh, yeah.
My cousin comes up every month for him.
But I know that something that we can help them is, and Gina touched on that briefly, is the plasma-rich, the platelet-rich plasma treatment in their scalp when they're losing their hair. So can you talk about that?
Again, we do the same thing as far as getting the blood ready and use the plasma because, again, the plasma has the growth factors and it's basically nutrition for your head. It could be 3 syringes that are able to get it out when it comes to the blood, and then we just go ahead and inject it around their scalp.
Right.
We start doing 3 treatments back to every week, and as time progresses, we see how if there's any growth, because the actual hair follicle has to still be there. If the hair follicle is gone, unfortunately we can't do anything about it. And just keep in mind, this is not only helpful for men but for women.
Yeah.
We women have hair loss, including myself, and it's very important, especially around I can't even think right now. I'm thinking in Spanish, las entradas, which is basically right on the forehead. So the hair gets extremely thin. So it's good to again bring some nutrition back into
And
that
menopause reduces hair as well for women.
That is true.
So it's a great thing to start as you start seeing it come out, to start right away.
Oh yeah, that's the most important thing.
Yeah, I always.
The sooner the start, the better.
Yeah, I always say how men have such an advantage because for whatever reason, if a man loses their hair, they still look good.
Yeah.
It's
When they go gray, they look good.
Yeah.
When they lose their hair, they look good.
When they go gray, they look distinguished. I mean, I happen to like men with gray hair, so it's Gina knows that.
Yes.
But As far as the women, I mean, when a woman is thinning, her hair is thinning, it really makes you feel bad. And the problem is that if you think about it, you know, what are you going to do? Like wear a wig? You know, there's not a lot of choices. So this is important, but it's important that they actually come in as soon as it starts happening, right, Edna? Because the follicles, like you said, have to be open.
Yes.
So, and I'm going to talk a little bit about an experience that I had, share myself with all of you. And there was a treatment that I got, and I didn't even think I needed it, but somehow, you know, I was convinced that to get it done. And it was on my lip. I got fuller lips. Fillers. But I'm going to say that actually there is a way of correcting that because I was able to get it corrected in our facility with radio frequency. And as you can see, I don't have a thick lip. This is actually my natural lips. Anyway, Gina, it's over.
It's over.
Oh my goodness.
It goes so fast. Thank you, Edna.
Thank you so much. Take care, guys.
Have a great weekend, everybody.
Bye. Bye, everyone.
Bye, everybody.